You are watching Liberty Online TV.
This is Liberty Online TV powered by Orange Sierra Leone. Orange. This is Liberty Online TV powered by Orange Sierra Leone. Orange.
Good morning, viewers, and welcome to the first edition of the Breakfast Show for this week, where they come to you live from Liberty Online TV, where they stream on Facebook, YouTube, and also on our website, where they powered by Orange Sierra Leone. We will bring the program come to you this Monday morning. Mina Agnes Bangura.
And Mina Mebelka. Good morning. Today is Monday, the 12th day of May, 2025, and inside this edition of the Breakfast Show today, we can talk about the monkeypox, waiting governments on the do for ensure say the spread of the Mpox reduced. As at yesterday afternoon, the reports will come out from the Ministry of Health as updates now that the western area urban when Afritong don't get over 1,326 cases. 11 people in total don't die from where Salon recorded the first case of Mpox. While waiting on the happen in terms of preventive measures where the government they put in place for let people not go spread this virus, and that's what they discuss in this edition of the Breakfast Show.
Well, this and plenty other issues them did at the program for you this morning. Plus, we go talk to Melvin Tijan Mansari, when a journalist, where after 64 days we don't appear before the Committee on Ethics and Privileges in Parliament after the Speaker of Parliament been banned from going to Parliament for let it do in work. Well, finally, they don't table these reports in Parliament, and they ask Melvin for do a public apology in a radio and also on a social media platform. Then before them will reverse the decision back, they begin for going to Parliament and do in work. What does this mean for press freedom? You will know inside the program. You said for the watch with this morning, you get any question about the Mpox sick where the salon right now? And as of the daily statistics where the National Public Health Agency, the poll, they show say the numbers then they go up every day, which you need for do for prevent yourself. How you for ensure say you not come in contact with somebody we don't get this sick. All of that we go discuss inside the program this morning. Remember, say you say for the watchway, you get question, you want to know more about the Mpox, send them in the comment section. Now any of the platform that we the watchway, as well as stream na Facebook, YouTube, and also now our website where they powered by Orange Sierra Leone. We will read on our questions them later on inside the program this morning. The program where they watch now the Breakfast Show where they come to you live from Liberty Online TV.
All right, we will continue with the show, and for the first issue inside the show this morning, we're going to Parliament. Also, for sake of the plenty challenge within the education sector, especially the number of picking them, we don't they go up and up and say the worst exam. Make the Parliament being called on the Minister of Education when at the basic and senior secondary education when at Conrad Saki for go explain to Parliament what's at the problem na this sector. Al Hassan Kuruma Bindede and Ego reports.
Friday, May 2nd this year, the Minister of Basic and Senior Secondary Education been hold a press conference with journalists them for update the public about the 2025 WAS exams, where presently they go on na the country. The press conference been about for see the ministry work with the Conference of Principal for Secondary Schools, the SLTU, the Anti-Corruption Commission, and the West African Examination Council WAEC for make principals and school administrators them, candidates, parents and stakeholders them for follow the mandatory protocol for conduct the 2025 West African Senior Secondary School Certificate exams, the MPSC and the BECE. The Minister of Basic and Senior Secondary Education, Conrad Saki, in the talk, he said the ministry don't know but the fake BRS where principals need to get to student them for write the 2025 WAS exams.
Alright, welcome back. Apologies for that clip there. We go bring the right clip outside Parliament being summoned the Minister of Basic and Senior Secondary Education for go explain what's in the happen at this sector as plenty picking them down the left behind this BNTM we not in the seats the was. Well, in case you get any question for us or comments for me, continue for send them at the number +232 74200 545. This na the breakfast show.
We continue the program this morning. As we tell Una earlier today, we can look at the Mpox as the numbers them where they come out from the Ministry of Health, now the everyday statistics. So then they publish show say the number them really they go up, especially in the western area. Well, if you get any question, you want to know more about the Mpox, send them in the comments na any of the platform the way they watch we. As this morning at the studio, we get Dr. Agnes Bangura, we are the lead for case management from the National Public Health Agency. Good morning, Doc, and welcome to the breakfast show.
Thank you very much.
All right. We know say right now that they deal with a crisis, and a lot of people not don't get the awareness. We didn't talk about the Mpox. Some until it begins see social media pictures of people who don't get affected. Then we first start for talk about what you say Mpox. What this really mean?
All right. Thank you very much. So Mpox, we call our first name monkeypox. So because of the discrimination against the monkeys, so they say now na Mpox. So Mpox na a viral disease like common cold, like coronavirus, like Ebola. They all are viruses, but in different a different group, a family of orthopox viruses. So in presentation completely different from COVID and from Ebola. And they affect mainly the skin. The skin na another organ, right? So like respiratory system, na corona. Ebola they affect the other system then, but this one are the skin more they affect, and it really painful. So basically, Mpox na a viral disease where they affect the human body, and they come out from it. They come from a zoonotic transmission to the human beings, and then once you don't get this human to human transmission, you share them through contact. Mama they give pikin where the pikin in belly. It also they be shared through sexual contact. So now then we don't see say this Mpox here they be transmitted continuous human to human spread. So now through the way they are so this they happen.
How the Mpox they manifest?
Okay, so we get two phases. We get the invasive stage where now within your body you feel them. So that's right for break and down. So when now within yourself you feel like you get the fever, you get that bad headache, you feel weak. Then you know the show. Now you feel within yourself, right? So you get then kind of experiences then when you get the skin eruptive phase now when the rash then don't begin can your body. So then rash here they come in your body, probably between 5 to 10 days. Then rash here, they come up after you don't get the fever, the swollen lymph nodes, them, the groin, they get swelling. Then you get the rash. Then you become infective. So once you don't get the rash, then you become infective. Then you can transmit onto other person.
As we talk now, a lot of people not don't gain the awareness, say this sick is real and it in a salon. When they talk about the severity of how the Mpox they evade communities, how you would describe it now so that people will get this understanding, say Mpox is real?
Mpox very real. I think the awareness done there now, because nobody now will tell me say no know somebody yet we don't get her, especially in Afriton. The community transmission really there on the rampage. One, because of limited bed space, we not get enough bed facilities for admit patients. Then that's not the honest truth. So patients that they diagnose there, then they go back into the community. So that continuous spread there, and they take public transport, and they touch people there. And once you don't get that rash there, you are infective and you transmit the virus. So now that way they not the problem now where we need to understand, say it's real. Let we limit the contact, let we limit overcrowded places, let we limit the handshakes. I don't know if now we culture for hug, but people that don't begin to get that culture enough for hug people that when they see them. So we can limit that and they, I don't know, and then wash your hands as frequently as possible with hand sanitizer, with hand wash. If water not those side, they just use hand sanitizer.
Even with them, we ask the public for the do. You make mention of one important thing where people believe say now that's don't they make it spread. I bet they watch the testimony of somebody where they recover now, where be they explain in your ordeals. They go to hospital, they're not able to check them that day. The people have been boku and so many cases been there of similar thing when at the Mpox, it been get for go back na us. Maybe they explain say Usai ain't go to the hospital is see where people and they go abandon them picking and they say if you know well not come back na us. So in that kind of circumstance here, especially where the numbers and they grow on a daily basis, somebody don't see say it don't get the rash, you go to hospital, like you say enough bed capacity not for admit them all. How that person for manage in situation, taking into consideration it gets for go back na in community where it already done the manifest. How if for managing self?
So we don't see say another work. We don't see say people there we housing conditions and salon completely different from waiting they happen in other countries there. So we don't see say home strategy when I want pan the strategy the way they manage Mpox. They either get facility based care or you get home based care. So we don't see say the home based care not the work. So we don't get the police training school. Don't offer for support the National Public Health Agency with a 400-bed capacity treatment center. We go there yesterday, and they don't say by Wednesday, that's next tomorrow, it will be up and running. And then there is another one, Calba Town, where we don't go look, we don't get approval, where MSF Belgium, they support. And then they say the renovation and all things would take about a week or two for complete. And then once done, and then there's another one I put local as well where the leadership don't go look. Once all done and they up and running, we they stop home care. So anybody will get diagnosed with Mpox, they go to treatment center. And then the other facility, all hospital don't get the order now for institute isolation until the lab results come. If it's positive, okay, you go to treatment center. If it's negative, you continue your normal essential services where you can for. So we therefore try for see, if not to Mpox, waiting cause the rash, and then treat that condition there.
How long the lab result they take for come out?
Ideally, it will be 24 hours. So we don't agree with the facilities and say for hold patients for at most 48 hours because it can get challenges with powers and power supply and then kind of thing. So if anything they happen, it can lead to a delay. And because of the limited lab capacity as well in the country, currently, there are 5 public health labs in the country, and 3 already in Freetown. So they don't start for do testing at Kenema and McKinney. So all that will help for reduce the turnaround time for the lab, and we go make people and they get the lab results a bit earlier.
Currently, we can't wait how the cases and they increase every day. When I get the capacity for curtail the spread?
Capacity as in the human resource numbers.
You just talked about earlier, say, bed they know they for admit people they will not don't diagnose. Some man they go back into the community. Women say now one way than they for spread them back, because if you know able for all you treat them until it done, you go back to the community. Now so it is spread them. Apart from the bed capacity, una not get. Even una self as the medical practitioner them. That much capacity they for curtail the spread now.
Yeah, the capacity day. So the challenge was the treatment center. So once that they don't come up now, we don't reach out to the Ministry of Health. So then they support with human resource. So they don't give we nurses, then suppose for postdoctors and CHOs, then hygienists, nutritionists for support there and so once done and they up and running, I think the capacity in country day, capacity for manage the cases then a day, trainings then they go on, and for build people in capacity, so then they already they in place.
Based on the cases them where they're gonna different facilities them, how you go describe how the chain turn like the spread, how the chain really turn like?
So we think in our community spread they going right now. Before we get we index case, the first case na saloon, we be afraid to say we go import and come from the Central Africa basin. So we target I mean for going to the border districts and say apparently the virus disappoints we. It shows say there was community spread before we notice. So basically now what do they're going after the virus. So that's it.
Because that's not the big question. A lot of people they ask say the Mpox will start listening to the news now DRC bottom. So how it reach come na Freetown? That's not a big question. We don't know if research will show now a link as to usai comot in cancer alone.
Okay, so in between 2012 and 2019, we been get some community spread. So not the first time this Mpox in cancer alone. So in 2007, I think, or thereabouts, we don't get Mpox, and from then to 2019, we don't get 4 cases. But we not be they not been get any proper documentation for we able to understand what may happen, how the patients are being recover, or the outcome of the disease. So when this one come out, the lab don't begin to sequencing. So sequencing now follow we understand the epidemiology of the virus. I'm not talking about for understand the characteristics of the virus, usai come out, how it be transmitted. So we hopeful say there is a potential that we'll able to do that in the Nasalo now. So we don't do some tests this weekend, and we're hopeful that the results could be very productive. So once then they come, we'll be able to know what actually happened. But the good thing we know say the way they have with transmit in salon na declared 2 compared to the way they na DRC we na declared 1. Whether on the more virulent, more severe, and more transmissible, so they transfer fast past the way they happen so now. So but we need all them sequencing here so follow way before know what actually they happen and what actually they go on. So once we get the one in there, we'll give the public update again on what's in the current situation.
Mpox they transfer through saliva?
Contacts. So I don't know how you go get somebody in saliva pass if you know contact, right? So through contacts. Yes. So you must get for contact the person for getting saliva. And through sexual contact. And saliva probably most times can be part of sexual contact and then kind of thing. So it's possible.
What about the variation? Because some sick then the way they attack, the way how big person will respond to them, picking up respond to them. So how the cases they don't sound like?
Okay, so we dey see am pan picking them, and belle woman we don't get patients we about 15 patients we not pregnant women. We get babies there. Right now we get about, we don't confirm about 6 babies there. The youngest na 2 weeks old baby. So that one day we dey think say they are na from a mama I don't get the virus, or through touch where people are picking, they always get for care for them. So person don't touch her and then the virus don't spread to the picking. And this more severe one there, now people there way immunocompromised. So like people there where they live with other conditions, so like HIV, polycontrolled diabetes, young picking them, pregnant women. So they one and they obviously now we high risk group there. And then one day we want for manage now them not been the priority for managing our hospital, even when we been get limited bed space.
You're in charge of the case system, case management. And as it is now, based on waiting on the tell the public on a daily, the cases they're really high, and the numbers then they show Western area. Why you think say the Western area also when they deal with crisis like this can be problematic? I remember the time for Ebola, COVID, the numbers then be really high, and Western area being given a tough time.
The demographic distribution of the Western area, we highly populated, sanity in a problem, the congestion, and the main thing. And then people are very mobile now. Then they come here, go do business now, different partner, the district there. So now I make this thing just scatter now Western area now. And then obviously the sexual transactions and all that kind of thing, and it did more now now big cities there, even not to Salon almost if any other country or any big city always gets that kind of transactional thing in this. So it's possible say that did lead to this exponential spread of the virus.
Doc, based on the figures them we you can see every day, it don't reach to a point where on a feel say residents in a Western area for become worried and take more preventive measures as to waiting than they do now?
Certainly. We all for be worried, even Mrs. especially when you go see the patients in a hospital and they're in so much pain, they're not able to wear trusses, they're not able to tie lapa. Now lapa number sorry then they tie. Man they tie lapa, woman they tie lapa, because it actually the rash they so plenty in your body, and when it don't get water inside, if it bursts, it make like way you get bones. So it's painful, they're not able to lay down, they're not able to sit down. And if you get other underlying condition, it even make them worse, especially with HIV patients them. And then if you see young baby, 2 weeks old baby, it is in so much pain. You yourself need for be worried, honestly. So it's really something we need for take serious as a country, and try for do we own part, because we as the healthcare workers then can do we own part. But if the community don't understand, not accept, say yes, this is real, not to tell them this way we make money. There's no money in this yet. And the worst, probably the worst outbreak this way, not get money. And we they do all things within we own resources as a country. So we need for understand, say we the people then get for taken serious. We not go able for change people in perception, and then get for accept, say yes, this don't. We go able change in perception based on continuous education. So we go continue for talk, but now the action get for come from the people there. And once they understand, say yes, this now, so then we go see the decrease.
And most times, because so many people can be in denial, now that can make some sick where they can ask for the content.
Sure.
Let we look at this. If there a community outside the myth but people not believe, say, but we don't get fever before, we don't get chicken pox, and now they don't come promote and say, na Mpox. How you go explain to the kind people in the we just believe say this not to Mpox, na chicken pox, so we don't do it.
All right. So for chicken pox, even the clinical presentation completely different. The way how the rash they begin pan chicken pox now from your extremities they can inside. For Mpox now they come on your chest, it go na you under. Then for Mpox, if you buy like a donut, you get the rash, they get all middle. Then for chicken pox, you know they come on your palm, you know they come on your soles of your feet. You know they go na your private. This Mpox now the private is the worst because of the moisture within the private. The private both part, man and woman then. It really painful and it reach to a point it's like the penis they fall off. Because it eats the shaft of the penis, stay almost nothing on the left. And once that they don't happen, you know they say I'm pan chicken pox. Then kind of thing they will not hear I'm pan chicken pox. So all longer chicken pox so small. And it they stop. Sometimes 1-2 person go get another host. But what will they notice self pan this Mpox? People know they initially, we will get her, not the transmit until post within a use. We don't know what thing they happen. So all that they make they do this sequencing. Now, some people then they get them from contact, yes. But with chickenpox, if one picking get an adios, almost all man they get an adios. We're not to the same pan this Mpox, we don't know why, but we still they study them.
The transmission, if the person in that incubation period, some say the rash not manifested because it gets them but fever, dizziness and all. It's possible for somebody transmit them where the rash not manifested at all?
No. So Mpox, they only transmit them when you get the rash. So if you get active lesions, say, so the rash for day, then you get direct contact with somebody, then you can transmit the virus.
How una they manage them cases there now for ensure say una put a targeted timeline una fee say una go able for bring the cases then down?
So we don't give yourself about the first 2 weeks now for say all man go na treatment center. Inside that 2 weeks day, we continue with risk communication team will continue for sensitize
the treatment center
the up and running. Yes.
How many treatment centers do they expect for getting 2 weeks?
So
and equip them because forget the treatment center now one. Forget the right equipment so for enable una for treat the one the way they can at the treatment center now two.
Alright. So for Mpox, we're not get medicine we na antiviral medicine with na for Mpox. So what do they do na supportive care? So the Ministry of Health don't support through the National Medical Supplies Agency NMSA don't give some supplies then. So once done and the treatment center they don't open and running, the medical equipment and like the BP machine, the pulse oximeter, then small thing and they will able for monitor patients because I'm basically monitoring and symptomatic care with the give. So if you get that, we give you medicine for your head cold. If you get fever, we give medicine for your fever cano. If you get genital lesions, when the private part, if you get rash day, and because of the nature of the area, it's prone for bacterial infection. So we can give antibiotic, we can give medicine as well for that day, but not a routine. So if you not get the risk for get certain thing, we'll not go give you antibiotics. So like antibiotics not a viral medication. So if you take antibiotics, even you take next year, you not go well because not for virus and Mpox and viral disease.
You just make mention say una not get medicine for Mpox. What do you mean exactly? Na care not there for or now una as the healthcare giver them no get medicine for treating patients.
Okay, so Mpox in medicine tecovirimat, the drug of choice. It's not in a salon. We need to apply and get approval from WHO and blah blah blah.
So that's not just guess medication.
Not to guess medication, they give some symptomatic care, symptomatic management. Like even Ebola, they all are symptomatic management what they do. So if they get fever, we go give medicine, we go reduce the fever. If you get headache, if you get rash, we give medicine for heal the rash.
I don't start the process for bring the medication, because looking at the cases, how then they go up, it clearly shows say on a need for get the medication.
Yeah. So we don't start the application. None on the different departments they handle and they actually say them we don't not to assure. I know say them we don't start the process.
In terms of preparedness, because like you say not to the first in this way salon they get Mpox. We health sector now one we don't be challenged with several disease them and viruses we don't come for really test get the test of time, and before the Mpox we they get with first recorded case the ministry be don't they pull notice say this thing they out, although we not get them yet, but let everybody just be watchful. And now we come, we don't see say the numbers and rapidly don't they spread, and up till now we they get challenged as a nation for even get bed them most people for go admit. How prepared the health sector of Salon the way with all the, I don't want to say noise, but with all the preparedness, one they tell people them for prepare, but on our way they in charge. Now it don't come, it don't hit. We not even get treatment centers, and now they try for cater for let the country get treatment centers.
Treatment centers, yes, dedicated for Mpox, because like all outbreak, they're all different. We always prepare, like we don't do training, we don't develop SOPs for Mpox, we don't develop the home care strategy. All that things we don't do, we don't go do assessments at the border district hospital there for CC, then get hospital, then get isolation units, then get treatment center. But the Mpox come, it can't use different. It can't have free tongue. You understand? So always too we don't prepare. The small one that we able implement, and they implement, and then we catch up now. That's
you
it.
might say this is a question for the ministry, but let me just make the attempt for ask, because the question when they ask now why anytime when new disease come now that 10 day on go begin prepare for set up treatment center them for treat this particular disease.
Because all disease outbreaks and different, like COVID, we being need for get oxygen, but this now no need oxygen. So if we go prepare, okay, we don't know say Mpox in
you
the
might not
RC.
need for prepare say this now for this.
Yeah.
But if
The
we get
basics
existing treatment centers,
structures then they.
yes. If structures then they, why would I not just erect the existing structures rather than for go start all over?
No, we just they follow the thing that we be learn from Ebola and COVID, and they will implement now.
Let's take you to certain people holding at the treatment center them. How are they able to manage them? Say you don't need for come off or go back to the community. For example, information we reach in that the one there within at the Chinese hospital, proper structures not there for ensure say they not go back and mix with the community people who not get infected. Some even they come out of the center them for come buy food, they mix with community people.
Yes. So the challenge would they get now with feeding, I have to be honest, would they get challenge for feed people then at the treatment centers there. Not all the medication that we able get, so we don't do a holistic list again, because like I say, the kind presentation would they get now what they get from DRC completely different from the what they get now. So all them preparation and they will be don't do, the medication they will be don't ask for. When the patient and the cancer with genital lesions, they will not be there but genital lesions as much as with the area and Sunaya and DRC. So like we run out probably in before we reach the peak now. And now they get for restock. So the problem will be they get people and get for the go. Obviously, if you don't get food in your treatment center, you will get for go buy food, or your family member will bring the food can for you, or the medication then go get for right medicine for you for go buy, because no go left you say because medicine or they will left you like die or something. So as part of we home care, we go provide what we get. Doctors then they buy medicine every day at treatment centers for patients. That's not the hard fact, not the hard truth. But the ministry itself don't come up on board now. They don't take the leadership and the management. So all district health management team, they don't be activated for manage the cases there. And we just they provide guidance and oversight from the National Public Health Agency.
So whilst people still wait to let get all the facilities and we need, especially for the admit, let people with the commoner communities, we know say home management you nodded on, elect you say people more stay na us. We believe say before I go na hospital, so they know look after me family well they na us. They managing self the way how it feels say workable for them. Then set of people and the waiting need for be done. We believe say sometimes they na us. Some man even they prescribe for themselves waiting and feel say go make like how you been say for manage the symptoms them within the show. Waiting for do.
Okay, so as part of the revised thing that we don't do, we don't develop a package for home care services for people that we can afford for dinner house because it comes with a cost. Obviously, if you want for dinner house, you get forget post we go visit you na use. You get forget post we get for the go do you testing, so you get forget your equipment and for the check yourself and all that kind of thing. So we don't develop that there as well. So then they self go get for day for certain group of people then. That's like put and say the people are making more affluent, people are making afford them. The high profile people there.
The preventive method them now we wanna be announced say vaccine day, let people they go take. And even with the vaccine we wanna be say people for they go take, we don't get complaints where they come from hospitals, those like people they go, then believe say the one day when the healthcare provider them get and then they keep them, they want let people pay for them.
No. Okay, so regarding the vaccine will come very limited. We get approval for about 63,000. We only get 58,000 in country. That one they get for go to healthcare workers. We get for contact. So the people that we don't get contact with somebody, we get Mpox. Now then are the high risk, now then are the target people there. People there with underlying conditions like HIV people there. And then for picking them above, I think 12 years. But you need to get contact with somebody we don't get the Mpox. So if they don't do like enlisting, you name the part of them people and the way that person don't write say this person have been contacted and when then they go take in case in history before then taking sample, then you are entitled or you are eligible. So not for all man, we country population almost 8 million. So there is no way that vaccine will do for we all. So the high risk group then are the more get them. And then obviously if person don't get them, if they get certain level of immunity, we go make some time not go get them back. We need to do all the studies and then I make we collect so much data now so we can able get details and know more about Mpox.
Earlier, we really talk about the high risk people, them like the one who can really get the Mpox, deal with it in a different way. You make mention of like if people can get all underlying illnesses, them like HIV and other one them. Any structures they way una they use for get for no say this person yes to get underlying illness like HIV and the other one them. We go make your case different and una prepare a different treatment package for them?
Yes. Okay, so during the history taking, would they ask you past medical history, your drug history. So if you dey on medication for certain condition, you get for tell we. So like for patients that will get diabetes, so we go get for tell you say yes, you need for continue for taking medicine. You need for do this because you need your immune system need for be up to the task for the virus. And then for HIV patients them, we don't engage the HIV partners them because we get different organizations that work with HIV people there. So we don't engage them in this. So they come on board now for can support with their own treatment because their own treatment is more robust and all our challenge will they get. Let people then not stop for taking their medicine. Even if you don't go to church, we all are Christian, we all believe in miracles. But I don't know how to put it now. Miracle, we all believe in miracles, but you still get your miracle and still continue for taking medicine and live a better life. Because if you stop for taking medicine, you CD4 count they below 100. When you get this Mpox, you likely for die. And most of the patients that they die are the one that we know they take the medicine then, or they say they not believe say they get certain conditions. And if you're not the problem, we not they reach the it. So we need for understand say if you don't get certain conditions, hypertension you know the well, take your medicine. Diabetes you know the well, take your medicine. HIV you know the well, take your medicine. You go get a very good life once you get your medicine. Because if you get the underlying condition then yeah, you know they take your medications. Then this can meet you now. You likely for die and you likely forget the severe form of the Mpox even if you not die. So all anything they will need for understand them.
Let's take you back to the time where Unabidi handled the Ebola crisis. One of the challenges they Unabidi get as medical practitioner is the denial from the communities. A lot of people in Obi believe say Ebola was real. We make it be really get into people and the numbers then be high. And at some point, when I save the well body will command them, when I get infected, when I lost one colleagues them. In this crisis, what they deal with now, Mpox, when I still facing the issues of denial from the people.
A lot. So you will notice say like all the way to the do sooner for sensitize people there. Until we reach that certain level, say all man don't understand say Mpox is real. Mpox you get for take the extra precautions, wash your hand, limit contact with people there. We not go get them right. And we also, for this outbreak, we don't involve the psychosocial team. And even when we go do home care, we go with the IPC team and the psychosocial team for support. We just for say the person who's ideal, you get to hand washing stations, then you get water for the washing, we be give them some sanitizer just for support them. And then the psychosocial team, they counsel them. Even we they get stressed when we go to treatment center, we get burnout. So we self need some counseling at times we they get from we colleagues them, but it's really difficult. But we are getting there.
Already, Salonon gets about 11 people we don't die from. If we talk about the stages, them how they look like, we go reach a point where some man in system they able defeat the virus, but some man not able for defeat them.
Like I say, it depends on the person in immunity. So if somebody, most of the patients say, Lord will forget about stigmatizing certain people then, right? We talk science now. I don't know how, we talk science now, right? So if somebody gets immunocompromised system, it means to say any small meter, it begin and can down quick. So for example, if somebody gets poorly controlled diabetes, that person it possible say an immune system not strong for fight anything. Any small meter, it bring and candle. So now then kind of thing. So I could encourage people then for get a very nutritious diet. So your body go able to withstand the virus. And if you don't on any medication, not stop your medication. Even if you get Mpox, continue for take your medication. Basically.
When we look at the issue we get for doing the transmission chain, we know say public transports and they help people in they use on a daily basis, health facilities them at the same side and people and still they go get them kind of facility. If person they suspect say perhaps it don't come in contact, what you need for do? Where no manifestation or the but you know say based on waiting you don't hear you don't go some side outside somebody being gets then kind displayed in their body waiting for do.
All right, so we'll get the toll-free 117. So if you call that number there, you tell them what thing they happen, then it can link you up with the other department where you can see how for support you better.
All fever na fever. How Mpox in fever different from the normal? Because up till now people and still wait, perhaps they get cold, they get fever, but you know what thing happen.
Okay, so high grade fever. So then the person can hospital. You gonna say your body warm, but how you gonna know the grade? Because for Mpox, they say temperature greater than 38.9, I think, or 38.7. 38.7. Now a high grade fever. So people that will get Mpox and temperature they are above than so man can go even up to 40. So once you get high grade fever, would they say yes? Would they say okay for community surveillance based definition for we get different definition for Mpox. We get the one way now for suspected cases. So if you the suspect say you get Mpox, wait you for think for, if you look for. If you dey get one body, you feel na your neck, you get swelling, you feel na you growing, you get swelling, then you get rash. Just think say a possible say na Mpox. You na suspect until then collect your sample, not a blood with the collect. Then they can't take the rash because I make you if you not get rash, you know the transmitter.
Now all rash way for see now your body they become concerned or
for now, yes.
Mpox in your rash different.
In your rash different.
How describe Mpox
yes,
rash?
now they say around there you get old middle. If you boil, if you like a donut, you know donuts get old middle, right? The other rash there, you know, tansu. In get small eye no more something. This in get old middle. Then for probable case, if you know say you don't get contact with somebody, then you begin get them kind of thing that you don't talk, so you get fever. You see, say you don't begin get 1 or 2 rash. You don't begin feel swelling at your neck and at your groin. You self need for be tested. If you dey work in a community, see anybody will get rash. They tell you say body be don't warm. Let them go test them.
During the time for Ebola, you just make mention of the toll-free line where una don't activate back. So if somebody then I see they feel some of them signs and symptoms there we just talk about, una get the capacity for let somebody call that toll-free line they una rush and pick them up?
Yes. We get a call on Friday, I think. Somebody want go to hospital, no more to Canada take him because of the visible rash in body. We get for send ambulance go take him. We get Boko ambulance. They don't engage the names, the National Emergency Medical Services. Names. The one will get the ambulance there. So we they work with them, then say the support because names then they all sign at the country. So they don't dedicate 1 ambulance for Mpox na each district. So for support, but for Mpox, we no want for move patients. Also, then diagnose you, na they will manage you. So if they diagnose you na Kenema, we know they bring you free tongue. The Kenema hospital get the capacity for manage you there, and then you can well. So, than this.
What are the more at risk for get Mpox?
You want to be more at risk for get Mpox. We all.
Why?
Because we dey touch people na contact. So baby them from the mama. Just basic contact.
So if you know they get contact, skin contact with people much, for example, like oh they are so can work na money, I didn't say my office, stay away from my colleagues them. The risk of me contacting it is less.
Less.
Because I see people don't begin activate again the face mask. And according to what you explain, correct me if I'm wrong, you only get the Mpox if you touch somebody in skin. Not unlike during the time for COVID, where then they say cover your face with mask. Okay,
so for Mpox, we were going to treatment center. We can use mask because the patients and they emit the virus, then they excrete them.
What's in the mean,
Then they pull. Sorry, then
they breathe.
Then they pull the virus, like when they want get rid of the virus. But now when they boku side,
When they talk, so they come out, but
you not go see them no. Like they come as droplets, you not go see them. So I make what they go to treatment centers with the wear them because then they did them boku, so the viral load na the air no more. A boku, for you probably catch them. But not to when they work on a street, no.
So it clearly should now say they be transmitted through air as well.
There is a possibility. We cannot rule that out.
So isolation now one. again, where you make mention of. So if you a family of 5, then one house, £1 get it possible for let the family isolate this person and they give the home remedy them?
It's possible depending on the number of rooms where they get. If they get an extra room where that person they can able to in one green, they get in your toilet, then it can go there if we can able to isolate, and then after it all recover, the IPC team can go do the contamination of the home.
How now they do that day?
So we got the IPC people that way get their own policy, or their own not a policy then call them, then get their own guideline on how for the home decontamination. Then they do that and they.
Let me talk about home remedy, because all Sabi Salomon during COVID, all of a sudden they begin make ginger, garlic, and other things them, which are sure say when I go don't get close for the Mpox. Some people they don't begin for one, because pictures we made on they see na social media of people where they say they get the Mpox, they see them they rub pega pack white thing in them body, just like way they treat measles or chicken pox. Is that a remedy?
It's not. It's just a psychological thing. Because I don't know what's in the pega pack they do. I don't know.
Born inside.
Sometimes the virus go check, but I don't know. It go check his sleep. But I don't know. On a serious note, that they know the help. And even that money they take go buy that pega pack, at least you take and buy food, you go help in your immune response. And now they help. Then the white tea when they rub, it gets some amount of anesthetic. So it relieve the pain for a while, and then after some time it come back. So what would they advise? Would they give you medicine where they drink? And then obviously that itself can be part of that for let you rub, but not to that white one day.
In terms of managing the symptoms, then when people they display, waiting work for A, they work for B, because that testimony what you see that possibly they recover now be the social media was waiting go somebody else was saying we don't get them waiting and and I advise them for take, so in the house now they take them. Does it work that way?
No, the problem gets with medicine, people then feel to say now one size fits all. No. So it's possible say waiting work for you, not they work for this other person. So that one they definitely not they work. No.
In terms of case management, the health facility them, how best to not ensure say the one them way did it able for manage the situation in as much as they try for save life, then at the preventive side.
Okay, so we don't do some training, not to all the healthcare workers that we don't train. When we plan for do some more training this week for the one that we're gonna need treatment centers them, because we're not going to go put them, they will not train them. At least that basic minimum training they all go get them before they go. They don't train them. So one thing they tell with healthcare workers there, you get for prevent yourself from getting infected. So you have to be very careful, because if you're not well, you're not going to go do your work. And we all they get pleasure in what we do. So care for yourself, put on your PPE. We don't need that bad PPE. That one will be the way for Ebola. So now what would they do? They use apron. Then we put the yellow gown on top. Get face mask. If you're going to treatment center, you get your boot cover, and then your head shield, head cover. That's it.
So the one they waiting at the treatment center, the family members them, no, they stay with them. Now, they in charge, the health care provider, and then they in charge of them.
Yeah, no, you cannot. You know, go care person go let in family member go stay with an treatment center. No, because no one like that. We even they tape the place, so they even go near close by.
So if they put all them things there, how come they allow the patients for common?
Then they happen like you say in one facility. That facility they would all investigate and we they do the needful.
That's just an example of that facility, because they happen back now other facility.
Which one? No. They happen at 34 military hospital, they happen at police hospital. And also now go tell me say because na military or na security hospital there. They happen they happen at Connaught.
So talking about Connaught, as we speak now, how many beds when I get there?
Okay, Connaught, the infectious disease unit gets a 12-bed, will just be renovated by the MSF Belgium team, and we are happy for that. So then just renovate them, and then UNICEF supports with water. So there is really good standard hospital, and then we get consultants, infectious disease specialists. Then so then now they will manage only severe cases.
Doctor,
so now that's making a 12 beds.
Because there's an information that at this point now, then they ask patients then for go home because they are overwhelmed. And how the cases then they come, just like what you said, I don't know, they treat severe cases. The medical practitioner then they say you need for go home now, continue treatment, let other person come. That is the case at hand now.
The case at hand, all sign of return. No sign of gebid. 34 full, police hospital full, Juwe hospital full, Connaught full. So anybody where then confirm, yesterday we got 160 cases positive. All of them are at home. All of them are in the community. We don't have space. That's the honest truth. So now that's make we expedite these treatment centers. Yesterday, I go see, and they don't promise it Wednesday. The police training school will be up and running. Will they do the training for the healthcare workers? They will get the list already. Where will they post it? So we they do all with all thing humanly possible for that we get them up and running as fast as possible.
So una for be concerned if we deal with a crisis like this, una not get bid them for admit with patients.
We are.
Does it mean that the Mpox taken unaware?
The magnitude at which it is now, yes, because when we do preparation, like we look at Guinea, we look at Liberia, then they get like 5 cases per month. So now that's we based with projection now. And now for a day we get 160. That's really not what we planned for. I have to be honest.
Doc, not so secret say anytime we outbreak the Saloni, they expose the nakedness of the health sector, and the Mpox like clear manifestation of that now.
It not so like it help build the system. So any outbreak we can have opportunity for build the existing structure. So another thing like say that expose in our opportunity for we strengthen the health system.
Because I say it expose. If not a country we get a very strong health care system, all of them things that way they manifest. So now hospital they bid no they for treat patients them everyday cases, then they come, then they at the communities there back we clearly show say a headway not did for manage them cases there. Because if we're not able to bring the cases them out of the communities, contain them at the health centers, we're not able to reduce the spread.
To some extent, yes.
All right. Continue for the with we. The program we watch at the breakfast show and we get Dr. Agnes Bangura in the lead for case management. This morning we look at the Mpox where based on waiting on the professional don't talk now. It's really serious, and if you not person we not come in contact with anybody we get I go for take precautionary measures. We mean say you for limit your contact with people and if you get fever and if you see any boil where fever do not, according to doc, now for rush go to hospital, or you can call the toll-free line. Doc say then get facility they already put in place in case you're not able to get transportation. Motkano will take you because of the visible signs them. Then can come and take you and go to treatment center. Although then challenge now with capacity. We continue the breakfast show. They take short break. We'll come back. We will continue for engage Dr. Agnes Bangura. We come out from the National Public Health Agency and in the lead for case management.
Hello, Barry.
Hey, Sadie, what's up?
How are you?
Sabo, hook me up quick.
Some man go forget some football pictures them for this week. I don't check all the side them all day done. But that will help me to one way man going for ginger and swagger for this week.
Ask Leo.
Ask Leo? Who is Leo?
Ask Leo, Sam. I did it. No can cut me feeling. No. Allow me to finish my food.
Leo will help you open an account, check your balance, buy airtime to pop, send money. Leo will help you locate the nearest ATM point. Leo will help ease your stress by helping you get the most fascinating fixtures. Oh yes, for our football lovers. Leo will do this and many more.
Wow!
All you need to do is save Leo to your mobile phone with the number +232 79 919 919 and get to chat with Leo on WhatsApp. Go on, try it now. You can also chat with Leo on Facebook Messenger by typing UBA Chat Banking. Leo is your virtual banker who serves you wherever you are with just one click away. It is UBA. We are your #1 bank for all the right reasons. For more inquiries, call us on +232 78 200 200 or follow us on all our social media handles on Facebook, Instagram, and Twitter at uba.sl. We are Africa's global bank.
Hey! Enjoy the new collapse bundle price drop. Now you can get your weekly collapse bundle for 6 millions only on Maxit app. Download the Maxit app now on Play Store or App Store. Install the app and enter your orange number and password. Now follow them simple step here. Open the Maxit app. Next, tap the account. Then select airtime and bundle. Enter the number where you want buy for. Now choose the collapse bundle where you need and the one where go suit you. Finally, type your password. Bam! All things set. Subscribe to the collapse bundle today and enjoy more browsing for small couple.
Orange.
All right, welcome back. It's still Iwaji Breakfast Show on Liberty Online TV. And remember, say today in this edition of the Breakfast Show, we don't bring come to the updates regarding the Mpox cases. Them we don't increase, especially now the western area urban when a free tongue. We don't get over 1,300 cases as at yesterday, and also other parts in the provinces and they where they record high cases them as well. We make today we talk to somebody where they gonna public education as to how for manage yourself, not forget the Mpox, and if you don't get them, waiting and wait you supposed for do for let you know will spread them. In case you get any question for us or comments for me, continue for send them now the comment section at the different platforms I watch with this morning. Later in the program we will go for read the message them and ask the questions them to Dr. Agnes Bangura where they are this morning for answer all on a question them regarding the case management where it come to Mpox. So they come back to them shortly. Let me just go back now Parliament and watch the reports we Hassan Kurma put together as Parliament been summoned the Minister of Basic and Senior Secondary Education, Dr. Conrad Saki, for go explain waiting at the challenge we in sector they get, especially for the number of picking them when not on the take was where the numbers them don't they go up. Let me watch the report where Hassan Kurma put together from there.
Thursday, May 8th this year, the Parliament of Salone summoned the Minister of Basic and Senior Secondary Education, Conrad Saki, for answer to allegation we get for do with the number of students them we not get for sit the 2025 WAS exams. This invitation being come as a result of the growing concern from the public and other stakeholders across the country. The Minister of Basic and Senior Secondary Education, Conrad Saki, where be the talk on waiting cause the problem. He say now because of the principal them fail for upload cast 1 for them candidates them.
Explain these challenges and how we have tried to address and resolve them in some detail. Unlike the National Primary School Examination, NPSE, and the Basic Education Certificate Examination, BEGE, which are both national exams, to 2024-2025 school year, schools have been submitting entries for WAS directly to WAEC without any checks by the ministry. Prior to the sitting of the May and June 2024 WAS, it was brought to the attention of my ministry that one, some schools appeared to be entering bogus candidates, and two,
He continues to say the ministry been write the West African Examination Council for reopening the portal.
For the rejection is that Sierra Leone had had a long track record of non-compliance with this deadline. Consequently, many candidates could not upload before the portal closed last year.
From waiting the minister say, nothing way the whip of the opposition, Honorable Abdul Karim Kamara, not been agree with. As he say, the ministry need for look inside the uploading system for Cast 1.
We are not generated by the ministry. They were generated by WAEC after the exams. So we keep paying for kids that were not actually taking the exam. Now, that is important in 2021 audit report, 2022 audit report, and 2023 audit report consecutively.
Honorable Matthew Sanyuma, leader of government business, been raised a point of order on waiting Honorable AKK talk, where that been create some chamot between Honorable AKK and Honorable Bashiru Siliki, deputy leader of government business.
Against the government, you're making a mistake. This is about solving the problem that has been into our society for years. Mr. Speaker, let me say again, the portal was opened by WAEC, a date was given. The ministry communicated to school on a particular date. But Mr. Honorable Bashi, stop this process. This is where the problem is. Wait, naming schools will not solve the problem. Allow me to explain my president. If you don't let me go to you making it seem that the portal was opened in June, and this minister asked the schools to submit in August. How do you want to deal with schools to submit? I have not tell me this issue. I will not quit the word. I will quit everything. I have not deliberately. You getting this thing out of hand. Just think I've done anything. No.
The minister end up say, government go pay for them picking them. We not able to sit the 2025 WAS exam as the ministry don't engage the Ministry of Finance for make them take funds from the budget where the ministry allocates to the Ministry of Education for pay for the students here. And also then they engage other international donors partner for ensure say they get fund for pay for the qualified student them where they left out for rights the 2025 WAS exams. For Liberty Online TV, Al Hassan Kuma the report.
All right, we dey continue the breakfast show. We dey come to you live from Liberty Online TV. From that report in a Parliament, we still dey look at another issue we get for do with the Salon Parliament. As we dey join now with colleague Melvin Tijan Mansare. As people can remember, Melvin na been one pan the journalist them way on the work na Parliament for a very long time, for close to first session them of Parliament. We mean say about 15 to 20 years now, you don't be a parliamentary reporter, but this being time, Parliament been get an issue with Musa then say he give opinion on the Auditor General, the former Auditor General Lara Taylor Pearson issue, and the Speaker been ban him not for going to Parliament and send an issue to the Committee of Ethics and Privileges for let them go investigate. They don't do the investigation, table the reports na Parliament and ask Melvin for do a public apology na radio and other social media platform them. What in this mean for press freedom? On the line, we get Melvin Tijan Mansare. Good morning, Melvin.
Thank you very much for having me on the program. Good morning to all listeners.
All right. I don't give people a brief background as to whose side this issue with Parliament begin, and after the investigations, it clearly shows say, but 64 days you don't appear before the Committee of Ethics and Privileges. Firstly, this committee will all be no saying for member of Parliament them. You as journalist, how it like for appear before a committee we comprised of member of Parliament them, you go through questioning and scrutining just because you do your work as a social commentator and also a journalist?
Well, I will tell you, appearing before the committee 63 days after the ban, and mind you, entirely from January 10, 2025 to now, it's over, I think, 9 or 10 days. So it's a very long time. But appearing before the committee was quite unprecedented. I think looking at the parliamentary record, it almost hard for any precedent to the effect where journalists face the ethics committee. But of course, yes, the privileges committee being get hearing with me, and that hearing was made public. Unfortunately, my lawyers were not allowed to represent me, so I've been get for appear in person. And of course, there were challenges for I read my statement because the committee is supposed to don't serve them before time. And that's also been passed. But thankfully, I've been there for serve the committee, my statements, and a 6 pages document where explain the context and background and in full detail excerpts of the audio we then get. And I've been making very clear to the committee that waiting be day before them, not to the full recording of which I've been talking 98.1, but I just excerpt. However, the committee eventually we don't produce their reports in which they make 4 recommendations, 3 of which one get for do with tendering an apology before the speaker right now the bar of Parliament. Another one going back to radio democracy and retracting and apologizing, and using social media for also apologize and do same. 3 recommendations for almost the same crime, but that already they under review with the legal team as to how feasible that would be. But on the what next, I think what's next is quite important because while the report was tabled, the chief whip of the governing SLPP party, Honorable Dixon Rogers, after Honorable Paramount Chief Marabi non-tabled the report, they moved that the report be debated. And Khadija, you don't cover Parliament, you know what it means to debate reports. Firstly, why was this call for the debate? We make several uncertainty loom as to what's next. But the fact remains that the process has been slow, but it's unfolding and it's unraveling in an uncertain manner.
Now, one of the things them way now the recommendation now for let you do a public apology and retract the things that we've been talk at this particular radio station and self-use social media platform. Although you say your legal team they review some of their recommendation there, but as a journalist, we all know what it means for retract. One, you can retract as a journalist. If you say things them way not to factual things, then you can go back, retract and apologize. But in this case, retracting and tender a public apology, is it something where you willing for do?
Khadija, I will tell you honestly, the cost is very huge because retracting and apologizing, it means for where I say some MPs they're not going to go work on time and not take some of them not take their job seriously in a lie. That's what logically it means. So I can understand seriously that my professional reputation and personality is on the line. And what if you apologize and retract and tomorrow you get for critique somebody again and ask you for do same? Will you always be in that capacity to always do the same? So I'm weighing the options. Of course, not doing it again will mean that, you are defying the recommendations of a parliamentary committee. Will make it more precarious for me because that will be a case of double contempt and all that. But Khadija, I think apologies should come from the innermost parts of people's conviction. If you are being compelled directly or indirectly to apologize, that in itself means a lot to what is called freedom of conscience. And I think this is where this conversation goes beyond freedom of the media, freedom of the press, and freedom of expression, and now freedom of conscience. Because if you've said something where, in fact, the speaker himself therefore attest in one of the sittings recently that the representation level of MPs in attending and not attending Parliament is serious, where many people feel say was just alluding to the fact, And if you go for go retract and apologize for that, what message it sends? So it's quite a dilemma for me. But like I say, I talk with the management and the legal team because, you know, I work for institutions and some of them are behind me and they show solidarity and including Sludge. Thankfully, it's coming at a time. Well, whether it's a coincidence or not, Sludge give me an award 2 days after we see the item is on the paper. So it's quite uncertain and challenging, I would say honestly.
Melvin, the last time when we talked to you regarding this issue, notwithstanding the way how Parliament take them, for you've been still stand by waiting you say and you've been believe in what you say for say not to lie, you lie. As at this time where the reports don't come out and recommendations they don't come out, anything don't change regarding your stance on your statements where you be make way cause all of this?
Anisha, I don't want to prejudice within management and the legal team go for come out with because you know it's a like I say now a precarious situation. If they ask you to apologize under Section 95 of the Constitution and you refuse to do that, legally, it will not be safe. For me, not being a lawyer, I already knew that because the contempt law in the Constitution of Sierra Leone is so complex and opaque, and it's so good that there is a constitutional review. I don't even know if this government is thinking about looking at Section 95 of the Constitution. What actually is contempt? You might feel, according to your conscience, that you are right. But once it is deemed impugning the repetition of MPs or parliament, it's interpreted differently. And there are rare precedents in which somebody don't take up a case and win against parliament. Except recently in the case of Anas Arimio Anas. And that's not to be Africa IB. We all know Senate courts abroad, outside of Africa, not even in Ghana. So it's quite precarious. So when people talk, say people are not in a jail, they're not in a prison, and there is freedom of speech. For me, I just say that it's a relative term because you have journalists who are free and roaming about, but are economically stifled or by their conscience being stifled. So there are emerging trends as to what actually now constitutes what freedom of expression and freedom of the media.
Melvin, this come, sorry, I beg your pardon. This come at a point where a report will just come out from the World Press Index show say Salone make progress in terms of freedom of speech and freedom of expression. And you they go through all of this because you express an opinion on what you think say they happen at Parliament. This go bring the question where many go on for ask how there's figures there where the international organization there they use, waiting at the yardstick and they use for determine whether there is freedom of the press na Salone.
Kadisha, when the reports come, the first thing we are going to go read them and see what's in the fact sheets. And if you go on their website, then get them fact sheets. Their fact sheets is only countenancing how many journalists killed, how many journalists in detention. That for me is half-baked. And I say, because for me, I've been on top with, of course, Reporters Without Borders, when this ban was placed on me, then get onto me. And unfortunately, my case was not captured in it. And I find it very interesting, but I think an issue where I get for right and bring up to the editorial team. I see all the sources of data, but if it's a report capturing a fiscal year, except then tell me, say, it was a report meant for last year, which I think is the case, but if it's a report capturing for this year, which should not be the case, it will be, for me, baffling if my issue is not captured as an incident in their fact sheets. But again, like I said, it's the reports, I think, reflecting the year previously, not proactively. So all of those are issues to look at. But for me, it shows that the benchmarks they already set, the indicators they already set, things then they change, and new tactics and patterns and they come on economically, politically, socially, where experts and analysts and data aggregators on the state of media across the world for look at. Because if we say that because journalists not in a jail or they're not kill anyone, and Sierra Leone is saying that one number killed, and of course that is captured when I won, and ironically, I was banned before that journalist was killed. So I don't know where some of those data are coming from. But for me, I'm not going to use my own case for make a sweeping generalization. But of course, I'm a living testimony of what freedom is or is not in countries like Sierra Leone.
Finally, Melvin, your faith hang on you going to the same radio, apologizing and also putting out a public apology via social media platforms. That's going to determine if you they go back na Parliament as a parliamentary reporter or they will continue for ban you. What in you expect? You want to go back? You want to tender this apology? What in people for expect, Melvin?
What in people for expect? The simple one that what will be the ultimate price for the truth and how much will Melvin be able to bear it? I think that would be the answer. What will be the ultimate price for the truth and how much? I already don't face the punishments for the truth. I know that. Everybody know that. But how much I can stretch in believing and upholding what I stand for is a question for another day. So it's not a yes or no answer. It has got to do with circumstances and a lot of other issues that are strings attached.
All right, many thanks, Melvin. We talked to we this morning. That's now Melvin Tijan Mansare, a parliamentary journalist. We don't face lots of issues with Parliament. We see the Speaker, Honorable Sengepo Solomon Thomas, being banned for going to Parliament because it say Melvin they serve as opposition against the Parliament. They talk things them na radio and social media about member of Parliament. Them this be make them send in case for the very first time a journalist go appear before the Committee of Ethics and Privileges. They investigate them. They don't table the report, and now Honorable Dixon Rogers they push say then for debate this report, and the Speaker say Melvin for tender a public apology at the same radio station and also social media. We will continue for follow how things they unfold. You just don't listen to Melvin. He say in legal team, they look at the report and the recommendation there and then go advise them waiting for do forward. We still get Dr. Agnes Bangura, when at the lead for case management. He come out na the National Public Health Agency. He don't they talk about the Mpox. Quickly, Lord, take messages where una don't send, we go come to Dr. Bangura, go respond, they will go wrap up the program. The first one they take now on the issues we'll just talk about on the phone. Also, we interview Melvin Tijan Mansaye. Lolo Gasparini, they say Melvin has no reason to apologize. Seriously, why should he? I honestly don't understand this Parliament. It's true that some members don't take their responsibilities seriously. So there is no need for him to take back what he said. I really hope he stands his ground and doesn't apologize or retract anything.
Right, so look at more messages. This one on the Mpox. Momo Musa Kamara on the Facebook, they say Sierra Leone is not proactive in terms of disease and viruses, saying it publicly that they don't have treatment centers. Are you ready to tackle this dangerous virus? A question where they ask.
Usman Kamara, they asked question to doctor. He said, Doctor, what is the update regarding the detection of the Marburg virus in the Egyptian fruit bat in Sierra Leone in 2018 and 2019? The study was done by Jalai University in collaboration with donor agencies. Is the risk of a spillover of human beings monitored? Thanks.
This one from Victor Fode, he say, how many HIV patients have been infected? Please tell us the numbers.
Liberty TV, the government sent out a notice about Mpox on the 5th of May 2025. One of the keywords on the notice is to avoid overcrowding. But on the 10th of May 2025, we saw the First Lady of Sierra Leone walking on the streets of Freetown, playing music with a lot of people behind her dancing in the name of Defeat Diabetes. What's your take on this, Doc?
Look at small messages. This other one from Mohammed Madinaba is using the same microphone during workshops or meetings needs to be avoided.
All right, more messages will go take. This one from Emmanuel Augustus. He said, this government is reactive rather than proactive.
On the issue of Melvin, he say even the Parliament itself knows they have not been doing anything serious apart from requests that comes from administrative head of government that will benefit them.
This one, they say, Doc, you need to pay attention on workshop. Different people using the same microphone and getting closer to each other.
Look at more messages. This other one, they ask, say, if I have been infected and at home, what are the preventive measures not to spread?
All right, from there, quickly they come back to Dr. Bangura for Lego respond. Yes, Doc?
Okay, thanks. I want to start with the treatment centers. We have 4 dedicated treatment centers there now, but all hospitals supposed for able manage in cases. For example, na Bombali, the government hospital, they manage them cases. No, na free tongue number we get 4 already. We already don't overwhelm. Now that's I mean. And now that make they do 2 more. We go take over 500 beds. And then the one post-local in safe days and the pipeline for start operations. Yes, like I say, if we see the first lady, they do campaign at streets with group of people for defeat diabetes. Like I say, the public perception get to be changed before we defeat the virus. So until we, as people of Sierra Leone, accept say there is a virus, we need for understand say the master sabi people and say for limit the contact, limit we exposure or na crowded place, then we can start for see the decline. So we encourage people and for stop for do start for do social distancing. We got a press briefing on I think last week, one day last week, where the Minister of Health actually don't give some guidelines that we for start for implement. All facilities, hospital, banks, forget hand washing station, we forget sanitizers, we forget the 1 meter apart distancing, even at the banking halls and then kind of place then so all them things they will need for reinstitute them. But it will take time for we able to adapt them, but we need for do them as fast as possible. If somebody then also get Mpox, it isolating safe, let it get in your own cup, let it get in your own spoon. Obviously, let it not share towels, let not share anything in personal belongings, in towel, in beds, linens, let you use them for instance. After it well, the plate and cup and thing and day we can either throw away or we burn them, or we decontaminate them. The bed linens that we can wash them with boiling water. We get the temperature. If you boil the water, then you wash the linen them. If you don't need for throw away. Now then kind of thing no more you need for the do continuously.
So as case management lead, as the virus day right now the whole country, what you go say now the most difficult thing for manage the cases them? What's now the greatest challenge?
The greatest challenge we will get right now, na space we not get. If we get space, we'll be able to manage with patients. We'll get the personnel there, we'll get the technical know-how. We need the space. Once then space, then they don't available. Then patients that we get comorbid conditions, it's also difficult to manage them. Especially if they take the medicine where they've been supposed for the take, where they don't diagnose them. If they take the medicine, it'll be very difficult for manage them, and then prone forget severe form of the Mpox. And once you don't get severe form of complications, the sequelae. So the sequelae. So the after effects, like when you don't well now, waiting will happen. It will get some deformities or that put on that way. You will get some deformities.
If you say the space na the greatest challenge, having the space now one, what about waiting on a need na the space? Because let me say you they ask say when I need space, then somebody say I get a whole plot of land. Okay. When I go take when I get seen them for equip day.
We they work with two partners then. And obviously if you get the space, if we don't get the space now, not to just empty ground, I mean as in space, the structure, the equipment there, the staffing, we'll be able to manage the patients. So what do we need? Also just the empty building, we need beds, we need medications, we need me a doctor, me not to engineer. So what I need for work, I need for work. Now treatment center, I need bed, I need vital monitoring equipment, I need medications, I need staff, like as they lead. So I need to be staff there. I need people for clean the place. I need the patient there for get food. So I then now I need what I mean as we need the space for.
How the agency they work with traditional healers them, because we all know say based on the case they manifest, everybody get interpretation as to waiting in feel say they do. How now they work with the traditional healers them for ensure say we then getting kind cases and way people can take the way perhaps and they feel say something as sick and send pan them and all of them traditional beliefs where some people get let them not make a spread. How now they work with them?
Okay, so they get weekly meeting, Mpox updates, where we get representative from the traditional healer, Dr. Bangura, I think that's really, yeah, they go by that. So Nine are the director of traditional healers there, so he always they attend every weekly meetings then. So and even some patients and they be referred by the traditional healers then. So we actually work with them and they are part of the response.
All right, many thanks, doctor. Somebody just send you flowers. They say this doctor is very realistic here about the Mpox compared to the other doctor who is at AYV now talking about the Mpox. All right, many thanks for you joining me this morning for can raise awareness about this crisis one they deal with now as medical practitioner. Them we will continue for the bring on as and when necessary so that on self go continue for tell people waiting them for do and let people realize the Mpox is real and a sick way they kill somebody and they on the spread now because of the challenges they get not able go into community fight at the moment. That'd be a pleasure for host you.
Thank you very much. The pleasure is all mine.
All right. Well, that's now Dr. Agnes Bangura in the lead for case management right now. And this edition of the Liberty Breakfast Show now, so it go tap for now. Many thanks to Musa Saukoma and Samuel Thomas. We give technical support to the production team for let this program meet you. Mina Khadija Bangura, they say have a blessed day.
All right, until we meet again, don't forget to continue for like, share, and tell more people about Liberty TV. And throughout the day, we get different contents and we will drop for one another different platforms so another gets we. Get a lovely week and goodbye.
Develop city, then clean, all clean city, develop.
This is Yvonne Akisoya, Mayor of Freetown, and today I want to talk to Freetonians about sanitation. We objective, transform Freetown, transforming lives. We not go able to achieve them if we all not join hands. Freetown City Council get role, but every Freetonian also get responsibility. Let me start first with the fact say FCC with the sweep 110 major streets every single morning from Monday to Saturday. But when we don't sweep the streets, if Freetonians then come and they continue for heap dirty in the street, you know they make the place look fine. Now make we get them litter bins them. The yellow bins we not go see around. So in the waka, you drink from your water bottle, your water plastic, you eat your packet something. Not even a ground where you done. Make sure so you put on one of them bins then they. That litter bin they, you know they for you host dirty. You know mean say if you pack you host dirty, you can pin her next to the bins them. Not to the idea that. Not give you host dirty. To them one way the Allah say clean salon. No say that dirty way they collect now you host. You know get for Karango now the one of the two official sites. You know they Karango Kisi Bome, you know they Karango King Tom Bome. It turns so it left on the ground. And now we council get a problem, but you said get a problem because now from somebody else in Domot, your own dirty don't end up. So what you for do with your host dirty? We get the one then a council where we don't certify. So then are approved waste providers. Then they on tricycles, some of them they a vehicle. You will get host, you will get business, you in a hospital, institution, everybody for make sure say the waste collected by an approved FCC waste collector. We get the tricycle groups, we get the companies. So So you go see them around. We engage with them on a regular basis. And wait till we go do now as we come into this new year. Now for make sure say FCC stand behind them for you for no outside and day and for let them self go to you so that we no go get that gap. When you eat dirty in a gutter, it end up na Lumley Beach, Toke Beach. All the tourism ambition where we get for the city, we lost that potential there. FCC, they spend boku money on dirty business. The fuel, the labor, the vehicle maintenance, the spare parts, the night operations, the illegal dump site clearing where we get for the do every now and then. All that boku money. I'm not gonna say we're not gonna spend anything, but we're going to reduce some. If Fritonians then do the right thing. Because we're not gonna get for go clear illegal dump sites. We're not gonna get for sweep as many streets and spend as long. So if we reduce that money we spend now on dirty business, we go able to put some on development. We all want for improving municipal schools. We want improving markets them. We want for let we see new developments at the city. That money we will use for dirty business. You and while we all make up with mind. Pay.
You are watching Liberty Breakfast Show on Liberty Online TV.